Hi, my name is David, and I'm a senior lecturer in finance at the University of Wollongong. My co-author, Dr. Carlo Caponecchia, is a senior lecturer in aviation at the University of New South Wales. Many of us purchase travel insurance without reading the fine print, which in most cases is not a problem. However, the recent COVID-19 travel restrictions caught many travellers unaware, and many of those who had purchased travel insurance were not covered by their policies. This was due to the pandemic exclusions in the policies. This was widespread in 2020. In fact, data presented to the House of Reps indicates that in April 2020, one large travel insurer received 10,000 claims, most of which would be denied due to pandemic or known event exclusions. There is a phenomenon known as reverse moral hazard, which has been documented in the medical insurance literature. When there is a reduction in medical coverage, there is a greater cost sharing between consumers and insurers. And in order to manage expenses, policyholders are more likely to forego medical care and treatment. Recent insurance experiences during COVID-19 may reduce the perceived coverage or value of travel insurance and lead travelers to seek alternative risk mitigation strategies. Travelers may compensate with overly conservative behaviors and choices, and these choices can have wide-ranging economic effects. One of these strategies is simply not traveling at all. Recent research indicates that 35% of Australians reported reduced likelihood to travel internationally after the virus is contained. Reverse moral hazard could result in reduced travel to particular destinations and impact tourism operators, local economies, airlines, and travel insurers. The corollary is that a destination's natural state of risk or ability to handle risk events will now be more important than ever. Moving forward, stakeholders must factor in the increased risk of travel, the lack of perceived coverage from travel insurance, and the altered decision-making process of travelers that heavily considers a destination's natural state of risk.